Knee flexion is 51 degrees during mid-swing. And there is 164 or 16 degrees of knee flexion during initial contact. With the Strobe Eyewear, her knee flexion improves by 8 degrees during mid-swing and 2 degrees during initial contact. For the third trial, her knee flexion has improved by 5 degrees compared to the first trial and remained the same with initial contact. Next, with leg press, her strength and proprioceptive deficits are visible. When the Strobe Eyewear is used, she has an increase of 14 degrees for knee extension, and with the third trial, there is a 9-degree improvement compared to the first trial. After leg press, knee flexion improved by 8 degrees during mid-swing and 2 degrees at initial contact compared to the very first trial. Once again, her knee range of motion improves with the Strobe Eyewear. Proper gait is 60 degrees of knee flexion during mid-swing and 0 to 5 degrees of knee flexion at initial contact, while she maintains the range of motion improvements during mid-swing and initial contact from the first trial after the leg press. To improve overall function, you have to treat the whole person, not just the body part.